Amidst this pandemic crisis caused by COVID-19, we assure you that we are trying to do all necessary actions as we guarantee that no one is left behind. Likewise, you are expected to do your responsibilities as a student by educating yourself and by studying harder. In this lesson presentation, we are going to tackle about how to distinguish aerobic exercise from muscle and bone strengthening exercises. An aerobic exercise is sometimes known as cardio exercise that requires a pumping of oxygenated blood by the heart to deliver oxygen to working muscles. It stimulates the heart rate and breathing rate to increase in a way that can be sustained for the exercise session. An aerobic exercise is a physical activity performed with a moderate intensity, with a lot of repetitive movements done within a long period of time. It can also lower blood pressure and cholesterol levels. An aerobic exercise enhances the ability of the blood to move air out of the lungs and boost the flow of blood to all parts of the body. An aerobic exercise involves a large muscle group that perform rhythmic and continuous movement for a prolonged period of time in order to improve aerobic capacity. An aerobic exercise improved cardiovascular fitness, respiratory capacity, and muscular endurance. An aerobic exercise uses energy systems that need oxygen to synthesize energy. A good aerobic session will include a 5 to 10 minute warm-up activity which helps to elevate the heart rate from 50% to 60% of our maximum heart rate, a dynamic stretching routine. The actual aerobic activity for at least 20 minutes at 70% to 80% of our maximum heart rate and a cool-down routine of 50% to 60% of our maximum heart rate. An aerobic session should end with a cool-down through a static stretching routine. Running is one of the best aerobic exercises that require only minimal training and equipment. Other examples of aerobic exercises includes swimming, dancing, kickboxing, walking, hiking, and there are many other types. Let's go to the benefits of aerobic exercise. An aerobic exercise promotes a strong and healthy bones. It means that as you grow older, your bones tend to demineralize or lose calcium. They become weak and brittle that fractures and break become a real threat. However, various studies have shown that to some extent, bone strength is related to any physical activities. The bone, like the muscles, tends to get thicker that is more used and exercise. An aerobic exercise also helps control physical and emotional stress. It helps improve your outlook in life and self-concept. It brings about a feeling and well-being of satisfaction. It helps reduce anxiety and depression. An aerobic exercise also helps to improve intellectual capacity and productivity. It means that in general, a fit individual can think, understand, remember, and respond more quickly. An aerobic exercise also sets a realistic way to lose weight and keep it off. It helps burn calories and excess body fats, at the same time helps maintain your desired body weight. Aerobic exercise also provides significant protection from any heart diseases. An overweight and obesity increase the amount of LDL or the low density lipoprotein or the bad cholesterol in the blood. High cholesterol can lead to heart disease. On the other hand, exercise promotes weight control and thus lowers the level of LDL and increases the level of HDL or the high density lipoprotein or the good cholesterol. Hence, exercise eventually helps lower the risk of developing heart diseases. Other benefits of aerobic exercise includes increased maximal oxygen consumption, improved cardiorespiratory function, improved cardiovascular functions, an increase of blood supply to the muscles, and an increase in the ability to use oxygen, an increase in the threshold for the accumulated lactic acid, an improvement in glucose tolerance, and the reduction of insulin resistance, an increase in HDL cholesterol or good cholesterol. Lower levels of blood pressure, especially for people with high blood pressure. A decrease in blood triglycerides, and a reduction of body fat. Now, let's proceed to the muscle and bone strengthening exercises. Muscle and bone strengthening exercises or strength training exercises are exercises that, while at the first half of a person's life, will produce increases in the both muscle and bone strength. Strength training is most commonly seen as a weight-bearing activity. Aside from muscle and bone strength gains, strength training also affects hormone health positively. Continued or executed at the latter part of a person's life, for example after 35 years of age or older, these exercises serve to slow down the weakening or loss of muscles and of the bones. The exerciser can use body weights or gym equipment to lift. Another way to provide resistance is the use of bands or rubber. There are varying opinions as to the number of repetitions for weight-bearing activities. There are two terms concerning strength exercises, and these are the repetitions and sets. A rep or repetitions is a full movement from starting point to finish, while a set is a group of repetitions. What are the benefits of weight-bearing or strength training exercises? With a good strength training program, a person will gain an increase in muscle strength, strengthen tendons and ligaments, potentially have improved blood pressure levels, gain a potential improvement in range of motions of joints, gain positive changes in levels of blood cholesterol, gain an improvement in glucose tolerance and insulin sensitivity, gain an overall strength, balance, and functional ability, have a reduction of body fat, and an increase in lean muscle mass. Hoping that this lesson presentation can help you learn more, I hope you would be very vigilant to observe the things that you have been taught and trained, as knowledge will really gives us the power to tread this rocky road academic journey this school year. Until then, see you in our next video. God bless and keep safe everyone.